compliments of a season, thank you for joining us as always on Head Plus today. Lately on Head Plus, you're watching Head Plus. My name is Msa Yakubu. Today, we are looking at a super dietary need. A lack or deficiency of iodine may lead to dry skin, hair loss, and constipation, among other symptoms. Consultant General Surgeon Stanley Ide has all of this.
Iodine deficiency is a condition in which the iodine in the body is low. This iodine is a trace mineral that is in the body, but this mineral is not produced by the body. It's only gotten from foods. Iodine deficiency is a state in which the iodine in the body is low. Iodine is a trace element or a mineral that is very vital for the body. But this iodine is not manufactured, it's not produced in the body. So we have to get it from outside source, like from food and from supplements. This iodine is important because it's one of the main elements that is used in the formation of a very important hormone we call the thyroid hormone. This thyroid hormone, the thyroxine and the triiodothyronine, they are very important in metabolism, growth and development, especially the central nervous system, the brain and the muscles. The absence of iodine leads to a reduced production of these hormones, which is called hypothyroidism. So when there's hypothyroidism, it presents in different ways. In adults, the patients most commonly have an increased size of their thyroid gland, which is what we call the goiter. Whereas in children, it can cause growth retardation and mental impairment. In adults, the most common symptom of iodine deficiency, which leads to hypothyroidism, is an enlargement of the thyroid gland, which is known as goiter. That's the gland that is in the anterior part of the neck. There are other symptoms of iodine deficiency can be weight gain, weakness and fatigue. You see the patients will be very weak, unable to do the normal activities. Some of them will add weight gain. Also, they may have thickening of the skin, hair loss, especially the eyebrow, like the lateral aspect of the eyebrow, they have some hair loss. Then in children, it can cause growth retardation, developmental abnormalities, and low IQ and low mentation. Mainly patients that don't consume animal protein, like the vegetarians, because most of this iodine is gotten from the animal source. So vegetarians are at risk. Also, patients that have an increased demand for iodine, like pregnant women, breastfeeding women, because these women need more iodine than usual, because now they need the iodine for themselves and for their babies. Also, people that live in areas where there is deficiency of iodine in the soil, like areas like in mountainous areas and areas that are prone to flooding. All these people are at risk of iodine deficiency. Also, people that take some foods that antagonize the iodine, like eating a lot of cabbage and unprocessed cassava. All this can lead to iodine deficiency. The diagnosis of iodine deficiency mainly manifests as, like I said, hypothyroidism. So the features will be weakness, adding of weight gain, cold intolerance. You see the people, they'll be feeling a lot of cold, even when other people are not feeling cold. And the anterior neck swelling, that's what we call goiter. You see the neck will be swollen. Those are the features. But for the test to diagnose iodine deficiency, usually it's a urine test where the urine is collected over 24 hours and checked for the iodine that is excreted in the urine. Now, if the amount is not up to a certain level, then you say this patient likely has iodine deficiency. It's actually one of the most common causes of cognitive impairment and mental retardation in children. When a pregnant woman has iodine deficiency and subsequently hypothyroidism, that affects the baby, because the iodine is needed for formation of the thyroid hormones, which in turn are important in mental development of the central nervous system, the brains, and the nerves. So when there's this deficiency, the children tend to have some mental impairments and low IQ. Iodine is deficient, the hormones that are produced in the thyroid gland are also deficient. That's what we call hypothyroidism. So if the gland sends a message back to the brain Then the brain releases another hormone they call the thyroid stimulating hormone from the anterior pituitary gland. This hormone now acts on the thyroid gland to try to increase its production to meet up with the demands. So the cells in the thyroid gland will become bigger and more. That's what we call hyperplasia and hypertrophy. So as they are trying to produce more, the gland starts getting bigger. So when the thyroid gland is getting bigger, that's what we call a goiter. It's important during pregnancy because a pregnant woman is at an increased risk of having iodine deficiency. And the baby in the womb is dependent on the mother's iodine for its development, especially the development of the brain and the nerves. So if there is a deficiency during pregnancy, there could be malformation of this baby inside the mother's womb, what we call that's congenital malformation. It can even be stillbirth. Then when the babies are born, they may not develop well. The muscles will not develop well, the brain will not develop well, the central nervous system will not develop well. So that's what they call cretinism. They have deaf mutism, low IQ, mental retardation, which is actually very preventable. Yes, prevention of iodine deficiency, like what we are doing now, is one of the ways we can use to prevent iodine deficiency. Advocacy, letting people know that there is something like that and some things they can do to avoid it. Then also government policies, like I talked about adding iodine to salt. It was a government policy that enabled that to happen. Even now, some breads, they add iodine to the bread. Then some packaged palm oil, they also add iodine to, them. Then also, if you know you are at increased risk of iodine deficiency, maybe you live in a mountainous area, or you are pregnant, or you're breastfeeding, you need to try to increase those foods that are known to contain iodine, or take iodine supplements, and also prevent taking some drugs that can increase iodine deficiency. The commonest sign is anterior neck swelling, which is a goiter. So the anterior, the gland will increase in size because the body is trying to produce more thyroid gland hormones. Other symptoms may include weight gain, heat, cold intolerance rather. The patients will be feeling cold when even other people are feeling heat. They'll be quite cold. Then sometimes they can have this thick skin. Then their hair will be fluffy. Some of them will lose hair, especially at the lateral side of the eyebrow. Some of the hair will get missing in adults. Then some persons may have constipation. Then in children, there will be stunted growth. They will not grow normally. They may have mental retardation because the nerves, the central nervous system, will not form very well. They may not do well in school. Then they may have deaf mutism. So some of them might be deaf. Some of them may not be able to talk. Then for pregnant women, they may have miscarriages, lose the baby, or give birth to stillbirth, that's giving birth to a child that is already dead. These are the advice I will have for the general public is that they should try as much as possible to eat foods that are rich in iodine, like cow milk, eggs, egg yolk and the egg white, fish, especially fish from the sea, and other seafoods like crayfish and all that. Then people that are at increased risk, like the pregnant women and breastfeeding women, can go for supplements. Luckily, most of the supplements for pregnancy all contain iodine, so they can avail themselves of all those opportunities.
Concludes the broadcast today. Always remember to tune into programs on the NTA and ensure you adhere strictly to the doctor's advice. You can watch these episodes and others on our YouTube channel, simply NTA Benin.